I'm Dr. Yasmin. I am a board certified gynecologist by training, and I have my own practice which deals mainly with menopause and midlife. And the name of my practice is Already Direct Gynecology, and I'm in Midtown. If anyone wants to take my card, it's right here, and you all can pick up one card, okay? Now, I was asked to speak today to make every woman aware that we do lose a lot of our bone mass as soon as our ovaries stop working. Each one of us have got a pair of ovaries. Do you know what ovaries are? And those who don't know, just raise your hands. Awesome. It's a part of our organ, just like my 2 ears, which I see in all of you. We have two ovaries on the right here and on the left here, just above your panty line. And those ovaries, they secrete three hormones: estrogen, progesterone, and testosterone. We used to think that testosterone is a male hormone, but not really. We also need some amount of testosterone. So why is that important? More and more science data is coming to show us estrogen and testosterone are needed to maintain the bone density or the thickness of the bone, and so that it prevents us from getting into a condition called osteoporosis or bone loss. How many of you have heard about osteoporosis? Awesome. This is the real deal. It is a silent killer of menopausal life, which means we hit menopause in our country here around 50 to 51. We start making these three hormones, and then we start losing bone mass. Can anyone guess how much of bone mass we lose between 50 to 60? 20%. 15 to 20% of our bone loss is happening in that decade between 50, 55, and 60. Although we are totally unaware. We're just walking, doing our lives, getting around with kids and grandkids and parents, and we're not taking care of our bodies till we get into a fracture or a fragility fracture, or somebody does a scan on you and they say your bone mass is low. We do a scan called DEXA scan, and I don't know how many of you have had that. It's called a bone scan or DEXA scan. And the DEXA scan in our country here is scheduled at 65 years of age. And in my book, it's too late. We need to be doing that at 50 or 51 when a woman goes through menopause, for reasons being, if you are in menopause, which means no menstrual cycles is menopause, right? All of you know that. No more periods. Yeah, it's great. I can get away, no periods, nothing for me for protection. I'm great. But there is a downfall from that time where your hormones are getting out. So it affects everything in your body, right from your brain to your bones. And I want to touch up a little bit on the other pieces of your body other than the bones, because brain fog, Alzheimer's disease or dementia starts from menopause. It's not something that pops up in 85 or 95. If we take care of our bodies at 50, 55, you are delaying that universal illness that happens in majority of women after 85 and 90. So taking care of your body at that foundation of 50 and 55, when your ovaries have stopped working, is the new science, is the new thing to take care of your body. Look at what you can do in terms of your sleep, your nutrition, your exercise, and your bone loss. Now, I'm going to focus this talk because they've asked me to talk only about bone loss, but you all can always hit me up with other questions on menopause. Bone loss is happening slowly, very, very slow. But if you're on medications like steroids, okay, somebody put you on a bunch of steroids for rheumatoid arthritis or some kind of inflammation in your body, you need to talk to your doctor to say, how long am I going to be on these steroids? Because I am menopausal and it affects my bone loss. Very important. The other thing is also anti-seizure medications. There are a lot of anti-seizure medications that women are taking, like carbamazepine and valproate and a bunch of different ones. They can decrease your bone loss as well. There are other medications that there is a huge big list that I'm not going to bore you with, but there are steroids, any form of depot injections. How many of you have taken depot injections before menopause for contraception or birth control? I think he's not interested. My bone loss talk. Okay, yeah. So always look at your pill bottles. Always look at your pill box in menopause to see, is this medication slowing my bone loss? Because it's so important for you to slow the bone loss. If you slow the bone loss, you're not going to, even if you fall, you're not going to have a crack in your radius. You're not going to have a spine fracture or a non-vertebral fracture like your hip fracture. If you fall on your hip, the risk of losing life is much higher in a woman who is 65 and 70 years old. With hip fractures, we can lose life. So most important to protect your bone density in your spine, your hips, and your radius, your wrist. All of these are important. You get joint pains too in menopause, and why is that? The reason for joint pains is there are a couple things happening in your body. One is you're losing your bone mass. Your muscle mass is also going away. How many of you go to the gym and you keep repping those dumbbells and you tell yourself, oh my God, what's happening to my biceps? It's not there. It's going away. I was different like 10 years ago. And why is that happening? Because again, you don't have estrogen and testosterone in your body to help you with that growth. Now, would I tell you to go on estrogen and testosterone at 50 and 55? That's a question many women ask me. And there is a possibility for you to go on bioidentical hormone therapy only for 10 years after menopause, like between 50 to 60. Sometimes we can even go up to 65. Up to 65 years of women, if women are low risk to take hormone therapy, they have taken it. And those women are delaying bone loss. They are pushing all the morbidities of aging a little further ahead. If she was destined to get fracture like about 65, she is pushing it to 75 and 85. So yes, estrogen, by adding that estrogen that your body is losing, and it is a similar situation where you have thyroid problem. Remember that thyroid gland? Do any of you know thyroid gland? Yeah, if you don't have thyroid, what do the endocrinologists and the GPs do? They give you levothyroxine, or they put you on armor-thyroid, or they give you Synthroid. And all those are medications that are replacing your lost thyroxine. Ovary is the same organ. It is a gland that is secreting 3 hormones. So why are we not talking about these women? Why are we leaving these women to suffer after menopause is the questions that doctors are asking today. There's a huge gender disparity. I don't have anything against the males because they support women and their partners, but there is very poor research and very poor funding for women's health. And that is the reason we are here today. That is the reason we have high anxiety. We have depression, we have osteoporosis, we have heart disease, we have vaginal and sexual pain with intercourse. All these problems are happening in menopause because we are not paying attention at the time these women come for annual exams. We just do a pap smear, a mammogram, and we don't look at your face for a year. Okay, so important for you to protect your bone loss. How do you, say you get your bone scan at about 60 years of age. For some reason, you have a fracture, you go to your doctor, they do a bone scan, and they tell you, you have osteopenia. Osteopenia is different from osteoporosis. Osteopenia is you are sitting at the edge of osteoporosis. You're about to fall into that well of osteoporosis, but we can prevent that. And how do we do that? We can do some lifestyle alterations in you. This is a beautiful center. I've come here like the third time here. And every time I talk about different topics, changing your activities, sitting at home, not doing anything. Sitting is the new smoking. Who agrees with me? Sitting is the new smoking. You got to get up every hour or every 2 hours. Move, move. 30 minutes of walking, any kind of cardio, mild to moderate aerobic activity. You don't have to do jumping jacks. You don't have to do burpees. Just do something to keep your heart rate up. The second thing is weight-bearing exercises. Very, very important. You got to challenge those bones and the muscles. You can, many women will tell me, my patients will tell me, oh, I don't have time to go to the gym. You don't need to go to the gym. You can just keep a pair of dumbbells, or you can even keep those loops, those little stretchy loops that you put around your knees, and you can do a couple squats and lunges, and you can just use the loops to do a couple biceps curls and triceps and all of that. You got to take care of every muscle in your body, right from your shoulders to your feet. And that way you're reducing falls as you're aging because your joints are supported by your muscle. Does it make sense? Okay, diet. Smoking and alcohol, the worst thing for bone loss, because you don't have estrogen, you don't have progesterone and testosterone. The biology is working against you. And why is that? Unlike in male system, the males don't lose testosterone by 51. If I take a blood sample of all these males sitting here, their testosterone will be pretty good, okay? But the same age female, if I take your blood sample and test you for these 3 hormones, you're going to be running on an empty gas. Okay, empty gas engine, and you're running the car. And what is the car? That's your body. Okay, but women are amazing. We have raised children, we are caretakers, and we do a lot of things with this body that the God and the universe has given us. Okay, we put up a lot on our bodies without taking care of anything. So if you need to pivot things in your menopause, the one thing I would say is cut back on your alcohol intake, cut back on your smoking, if at all you're smoking, or chewing tobacco, or vaping, or whatever form of tobacco is getting in your system, because that will accelerate bone loss. The third thing is protein is very important for you. It doesn't matter, even if you don't eat a ton of carbs as you're aging in menopause, 60, 65, 70, 75. The key is fiber and protein. Protein needs to be at least 50 to 60 grams. If you can kick in 75 to 100 grams of protein every day, that's kudos to you, and it's amazing. But majority of my patients can't do that. So even if you can push in like 50 to 75 grams of protein in any form, it feeds your muscle. It helps you to keep up those muscles so you don't have injuries, okay? So sleep is very important. How many of you struggle with sleep? Majority of my women here. Yes, sleep is the foundation pillar of wellness. If you're losing sleep, you need to address that. Do not ignore, don't take it for granted. The longer you're going to live, the better if you sleep. If you sleep better, you're warding away memory loss. How many of you do not want to lose memory as you're aging? 100%, including me. Okay? I would say a woman's brain is more important than the vagina. Yes. Okay, that's the belief I have. I don't care if you lose your vaginal capacity to have intercourse, I'm fine. I don't want my patients to lose their brain because that's where I am. Okay, I'm in menopause. I do not want any woman to become demented or lose memory by 60. So the only way we are going to keep up with our brain power, your cognition, and your thinking process is with adequate sleep and really challenging that brain to get away from anxiety and depression and really cultivating positivity and really bringing in that positive ideas. Forget about the past, forget about the future, live in the present. Okay? I constantly tell my patients, do not think what you lost to the back. Aging is something that you're losing. Aging is a process of grieving. We are losing our youth. We are losing our kids. They are grown. They've gone out of their homes. We are empty nesters. You're caretakers. This is all part of life. If you dwell on anything more, you're going to create negative chemicals. And what are these negative chemicals that can harm your body and give rise to cancers and autoimmune processes? Is cortisol and adrenaline. Who has heard about adrenal fatigue? Yes. Many women go through that because of the stressors, because of the trauma. They are being challenged every day to day, because the adrenal gland is constantly working, trying to put out cortisol, trying to put out adrenaline. And finally, they're so burned out, they're not able to cope and they get infections. Their immune system gets hit badly. They get infections, so they get diagnosed with autoimmune issues or with anything that is really gravesome for them to live till the end of life. Okay? So menopause, bone loss is just the tip of the iceberg. So I would say, as soon as you stop your menstrual cycles, it is time for you to pause and reevaluate your entire life. And even if you need a help of a menopause specialist, somebody like me, go find them, because you will definitely benefit from them. Because what can we do? We can look at your individual history. We can look at your health history. What are your risk factors? Are you a candidate for bioidentical hormones, or are you a candidate for just lifestyle alterations? What can we give you as a second opinion, which your general practitioner may not be giving you, because our health system is unfortunately broken. Being a healthcare provider, I'm telling you that. We don't spend as much time as we need to with our patients. We should be spending 60 minutes after menopause to talk about menopause at every annual exam. How many of you got 60 minutes with a doctor? 7 minutes. They did a study in University of Cornell in New York. 7 minutes is the average face-to-face time between the doctor and the patient. We need to change that. The change is going to come, but by the time the change comes, my patients and me who are navigating menopause will be done, right? This present cohort will be done. It will be great for our kids, our grandkids who are coming 50 years later into menopause. Healthcare will be probably in a better position, but today we will be done, right? So I think to advocate for yourself is very important. You pick up a book, you pick up something to read about menopause today. Any information that is out there, real science, not just Google and some misinformation about breast cancer risk and all of that you worry about. Don't pick up that. That came from a very old study about 25 years ago that we did to say, oh my God, I cannot go for hormone therapy. It's just going to kill me. I'm going to get breast cancer. All that came from a study in 1999. We have moved on. There's a lot more new science. There's a lot more data that's coming out. But if you stay under the cave, if you stay under the chair, nobody's going to tell you. Your life is just going to pass away. So you got to advocate for yourself with your doctors. You got to read this. You got to go and challenge the doctor. Doctors are not getting time to be retrained. They're not taught in the medical schools and residency. I went through medical school and residency. Nobody taught me about menopause. I had to go and relearn. I had to do a fellowship and really understand what menopause is. When I was going through it myself and I was thrown the same old rhetoric, saying, this is it, just live your life, suck it up. You don't need to suck it up when we are sending people to the moon. Okay? You don't need to suck up menopause because we are going to be living 4 decades after menopause. Average life expectancy in our country for women is about 88 and 90. Okay? But you can live up to 100. 88 and 90, so your menopause at 45 or 50. Can you imagine your life between 50 to 90? You need to support that. Okay. I'm not going to get into the treatments of osteoporosis because there are a lot of medications. There are different types. People will be put on Fosamax. Have you heard about Fosamax? It's a pill that is given every week. So that is a medication that we give you to stop the loss of bone. And there are some medications that we give every week. We give you some every 6 months. They are IV infusions. They've got their own side effects because this is all drug pharma. It comes with side effects, right? So anything that you put in your body, do not assume it's 100% safe. Okay, there's always going to be side effects. So why put in all of that stuff in your body when you can just tweak your lifestyle, your nutrition, your exercise, and continue to have strong bones and strong joints? Okay, awesome. Any questions for me? So I'm going to give it to Jay, my cards. If anyone wants to take it, you can take it. And you all can message my clinic, and there is a number, and you can either text it or message me, and then we will meet, and then we'll talk about what can we do for you in menopause, and what is bioidentical hormone therapy? Is that even an option for you? How can we help you? Okay. Any questions that you'll have for me? Be reversed or stabilized. Osteopenia means no. I'm just going to, maybe they can share, or do you have a photocopier? Can you make some copies? Yeah. Of that one card? Thank you, Jay. Yeah. So osteopenia is a stable form of bone loss, and you are there. But you always have to be very watchful that you could fall down from osteopenia into osteoporosis. So you have to start increasing your intake of calcium, your vitamin D, your exercise, and everything so that you don't go from osteopenia into osteoporosis. There is no guarantees that you will live in osteopenia all your life. You can always dip into osteoporosis. So based on your risk factors, I would talk with your doctor to get a bone scan for you, depending on how frequently you're challenged with your daily life. Like if they may say, oh, you don't need to worry about it. We'll do a bone scan in 5 years or 10 years. No, but if there is a steroid that you're taking, you're not exercising too much, and you feel your mobility has reduced, I would say, let's do a bone scan on you every 3 years. Okay, so it's a very individualized surveillance that we keep women on based on their risk factors. Okay. This is a great question. Yeah, pay attention to this. Sleep has to be a deep sleep. Average menopausal woman should be getting 7 to 8 hours of sleep. 8 hours is amazing. If you can kick in 7 hours, will be great, but 7 to 8 is the best. Some patients will come and tell me I slept for 8 hours, but it was a very disturbed sleep. Like, get up, wake up, busy mind, get up and go to the bathroom, or put your phone on and start scrolling the phone. That is not 7 hours of sleep. That's a very interrupted sleep, and you need to address that. Because sleep is one thing that's going to protect your brain. You need to get that sleep back in your system. Any other question? Yeah.
I've had osteopenia. You mentioned but you mentioned hormone therapy. Some of the things they're talking about, because now she's 66 almost. And guessing from what you said previously, hormone therapy is not applied after 55.
Yeah, that's a great question for people who are above 65 can hear this. North American Menopause Society, it's called the NAMS, came out with a consensus about 10 years ago to say hormone therapy should be given between 50 to 65. And after 65, we have to be very careful on putting people on bioidentical hormones because your systems have already changed. Like, remember I told you your brain is changing, your bones, your heart, and everything. But now, recently, about 2 years ago, we have revised that and said each person's risk factors have to be assessed. We don't need to put them on a full dose of hormone therapy. And if the risk factors are low, we can put them on a low dose hormone therapy. So it really depends on her meeting with the specialist and having an analysis, undergo a blood test to see what her hormones are, and then decide. Yeah. The main thing is we have to understand why you're losing sleep. Is it because of hormonal deficiency, or is this any psychological piece, any social piece, or work stressors? We have to go down to the bottom of why you're losing sleep. And we also test your hormones to see if they're very low. If you're within that 50 to 65 years of age, I think giving you a short trial of bioidentical hormone therapy. Now remember, bioidentical, not birth control pill. I despise birth control pill after 40 years of age. Not necessary. It increases the risk of breast cancer. You do not need birth control pill if there is somebody in your relationship who can prevent pregnancy, like if you've had a tubal ligation or if your husband has had a vasectomy, you don't need birth control pill. If somebody is putting a birth control pill on you saying your hormones are going to be fine, they're lying and they haven't been trained. Okay, challenge that. Do not go on birth control pill after 40 years of age if you do not need contraception. Did that answer your question? Yeah. Wonderful. I am happy that you all got some little nuggets about menopause, a snapshot into that. And I will be happy to take questions if y'all have any. If not, y'all have a piece of my card, right? Pretty much all of you got that. Awesome. Thank you for coming today.